When it comes to Medicare Star Rating, there's some important things to be aware of, and I'll cover all of that in this video. Many people want to heavily rely on the star ratings, but they're not always sure, one, what they mean, two, how they're calculated, and three, how can you use it to your advantage? So in this video, we're gonna go through all the basics of the star ratings so you know what to look for, how to use it, and also how to not read into other things as well. I'm Emily with the Medicare Coach. I'm an independent Medicare consultant helping our clients easily navigate Medicare rules and insurance company options to do what's ultimately right and best for you. And in the section below, I'll have some extra resources for you to give you shortcuts to make your right Medicare decision. So let's go ahead and jump into the star ratings. So Medicare has created a star rating up to 5 stars for both Medicare Advantage, which is called Medicare Part C, and prescription drug plans, which is also called Medicare Part D, as in drug. So the intent of this star rating was to more easily help individuals understand the good companies versus the bad companies. So they create a star rating to kind of, again, rate these companies side by side to make it more apples to apples. So when it comes to Part C, or Advantage plans, they look at things like the overall care of the plan, right? Did an individual get the needed care that they needed, right? Were they able to see the doctors? Were they able to get the treatment that they wanted to have? They look at things like customer service, right? How good was the customer service based usually on the member's review of the plan? How overall is the rating of the healthcare quality? How many complaints did the plan have? How many members chose to leave, right? All of those things go into these overall star metrics when it comes to Medicare Advantage plans. And I like this, right? I like the idea behind it, right? I like the idea of understanding who's coming, who's going, how good's the care. But there are a few critical issues to Advantage plans, and I'll talk about Part D plans next. But one of the things is that this is mainly reported by individuals. And you tend to hear from individuals who are unhappy. And so because of who puts the data into the system, you're not always getting completely balanced results. And therefore, I think that some of these things need to be taken with a grain of salt. Now, with that said, what I would love to know, especially in Advantage plans, is how many denials did they issue, right? If an Advantage plan is giving you more denials, then it's probably a red flag, because you want a doctor and a plan who are going to cover the healthcare that you need. Now, in the past, we used to have these numbers, and they stopped doing that anymore. And I think the goal was to have a star rating replace those other statistics and kind of put it into a one simple metric. And I think that the star rating has really missed the mark on this point. So my point is this: it is great in theory that we have a star rating for Medicare Advantage. What I would say, though, is take it with a bit of a grain of salt. If you go back to my processes, we talk about how to find the best plan. Number one is, should you even enroll in Medicare? Because if you have an employer plan, you should delay it. Or if your employer plan meets certain rules, you should delay Medicare. But then we go into, what are your priorities? Who are your doctors? Are you moving? What are the costs? Like all these other things that go into your plan. And if you follow that process, it gets you to a very similar output as what the star rating is trying to get you to. But my point is, star rating should be taken with a grain of salt. But if you follow our process, you could easily get to your right company, your right plan, all of those things. Now, when it comes to Part D, it's looking at a few other factors, right? Part D plans are not going to give you your most of your health care. And so Part D looks at things like, do they have a foreign call center? What are the complaints looking like? How many members are leaving the plan? Things like that. And another thing they look at is, are the members getting their necessary medications? I think that this kind of necessary medication metric is unique because many times it has nothing to do with the Part D plan. Getting a medication is usually because of a pharmacy and not because of a prescription drug plan issue. And so I think there's some flaws too in how the Part D star ratings are done as well. So again, take it with a grain of salt. When it comes to Part D plans, we do look at certain company, kind of how good of a company they are overall, but most of the times we're looking for a company who covers your medications, covers your pharmacy at the overall lowest cost. So again, star ratings, I don't think have a huge impact on Part D either. So again, take it with a bit of a grain of salt when making your Medicare decision simply based on star ratings. Now, I want to cover another aspect to these star ratings. So again, I agree with the concept behind the star ratings. I feel as though it's missed the mark. With that said, there are two other rules when it comes to Part D drug plans that I think could have been helpful, but they're a little comical at this point. So there's a rule that says if your plan is not a 5-star rated plan, that you can easily go from your current Part D or Advantage plan into a 5-star rated plan. Here's the thing. Where I live in my zip code, there's, I think, 12 to 14 Part D plans, and not a single one has a 5-star rating. And Advantage, I think we have like 56 plans, and not a single one of those have a 5-star rating either. So conceptually, if even a few plans have had a 5-star rating, this extra rule to change Part D plans or Advantage plans would be really valuable. But because not a single one of them has a 5-star rating, this rule really has absolutely no value. Now, there is another rule out there that says that if your plan is at a 3-star rating or less for the last 3 years, you could also switch Medicare Advantage or Medicare Part D plans. And this could be more applicable. Now, at the Medicare Coach, we are big advocates of reviewing your Advantage or your Part D plan every single year anyway. And so if we're being proactive, this doesn't ever really apply to anyone. But this could be a rule that some people could possibly use if your plan is under a 3-star rating and you want to have an option to go somewhere else. So my point is this. When it comes to star ratings, take it with a grain of salt. It had good intentions. I feel like it missed its mark. There are other things that I'd rather see, again, like Advantage plans in terms of number of denied services. I'd love to see that number. I do not recommend that you base your entire Medicare decision based on the star rating. Again, good intentions. I don't think it's been well executed. Also, while there is some rules to use these star ratings to your advantage to change plans, I think the most meaningful one, as of now anyway, is this 3-star rating. Under 3-star rating to change Advantage or Part D. So again, take the stars with a grain of salt. I have another company who reached out trying to create their own kind of rating system for these plans. And the reality is it's really hard to do it because of the lack of transparency in terms of how the Part D and Advantage plans work. It's really hard as an outsider to really have one size fits all. And that's why, again, at the Medicare Coach, we are big advocates of finding what your priorities are, looking for the company that fits your needs. Those metrics are out there, but again, it's not the star rating. So take it with a grain of salt. And I hope that you found this helpful. And again, check out down below for some extra resources to make your life easier when it comes to Medicare. And we look forward to helping you easily make your right Medicare decision.